So this is a loading technique to the side and also back part of your thigh. So we're going roughly where the hip bends to where the knee bends. So you're going to need a ball and a surface to sit on top of, relatively hard and firm. I'm going to place the ball down. There's two different methods that you can try. The first method is the seek and destroy. So what I'm doing right now is I'm going to start right in the middle. I'm going to go towards my butt, trying to find a sensitive area, and then I'll actually go down towards my knee. Wherever I feel more sensitivity, I'm going to hold. So I feel it right there. I'm just going to hold that position, and then what I'll do now is I'll swivel my bent knee that's at 90 degrees. I'll swivel it outward and inward. Wherever I feel more tension, I'm going to hold. I feel more tension right there. So now we're going to destroy it. How are we going to do that? We're going to breathe into it and add a little bit more load until it desensitizes. So I'm going to take a breath in, exhale, and just shift my weight so there's more load right on top of the ball. I'm going to hold that there until it kind of melts and desensitizes. After that occurs, then I can find another spot. So again, I'm going to go towards my knee. I'm going to go towards my butt. And wherever I feel more load or more sensitivity, I'm going to hold it. So I feel it right there, a little bit more on the inner side of my thigh. And then from there, I'm going to rotate my bent knee inward and rotate it outward. Wherever I feel more sensitivity, I'm going to hold it. I actually feel it when I turn my leg out. I'm going to hold that position. From there, I'm going to take a breath in, exhale, and shift my weight right on top of that ball so there's more load until it desensitizes. So the second technique that you can use is called the pin and stretch. So it's the exact same thing that you did in the first one. To find an area that's sensitive, and then I'm going to swivel my leg, my bent knee at 90, inward or outward, wherever you feel more sensitivity. I feel more when I'm turning outward, so I'm going to hold that there. And then from this position, I'm going to slowly straighten out my knee to tolerance, which is roughly about there for me. And then I'm going to hold that there until it melts or until I can straighten out my knee a little bit more, and then slowly relax the leg until it kind of desensitizes. And then find another spot. So what I'm going to do is I'm going to scan going towards my knee and then scan going towards my butt. And wherever I feel more sensitivity, I'm going to hold. I feel it right there. Then I'm going to swivel my bent knee inward or outward and hold that position, whatever's more sensitive. Next step is I'm going to straighten out my knee to tolerance. If I can only straighten it out this much, I'm cool with that. We're going to hold that there until it desensitizes. If I can actually go a little bit further, I'm going to go a little bit further. If I can straighten out my knee all the way, I will. And if I want to add a little bit more load, then I can actually point my foot towards my head slowly into this position. But again, it's progressive. You don't want to just go straight into that. So again, the steps for this one, which is super effective, you're going to find the area first, add the load on top. With the knee bent, you're going to swivel in or out. Whatever is more sensitive, you're going to hold. Then you're going to straighten out your knee. If you can straighten out your knee all the way, then you actually get to promote by bending your ankle up towards your head. If that's pretty good, just hold that right there until it melts, and then slowly reverse. Another alternative that you can do is you can actually keep the knee straight and then bend your spine. So what I'm going to do is I'm going to find an area that's sensitive. I feel it right about there. I'm going to swivel my knee in or out. I feel it more when my leg is out. I'm going to hold that right there. And then from here, I'm going to tuck my chin and curl my spine like a little roly-poly. Kind of looks like this. And then what I'll do is I'll hold that position until it desensitizes. So I'm tucking my chin, tucking my spine, rolling all the way down, and holding it until it desensitizes.